My name is Dr. Sandeep Satsangi, and I'm a senior consultant in the Department of Hepatology and Liver Transplantation at Apollo Hospitals, Bangalore. Today, in brief, I'm going to talk about a very important entity called as viral hepatitis. Viral hepatitis basically means that our livers are getting affected by viruses. To make it simple, let's subcategorize this into two types: acute viral hepatitis and chronic viral hepatitis. What does acute viral hepatitis mean? Acute basically means that something comes into our body, affects the liver, and then leaves the body. Chronic basically means that the virus comes into the body, stays in the liver for a very long period of time, and refuses to go to the body in most of the patients. Acute viral hepatitis is typically caused by hepatitis virus A and hepatitis virus E. How do we get acute viral hepatitis? The most common source is going to be contaminated water. Fecal-oral transmission from contaminated water is the most common source by which we can acquire hepatitis A or hepatitis E. Most of the patients will suffer from mild fever, weakness, satiety, vomiting sensation, and they usually improve. A smaller subset of patients can develop severe hepatitis, in which they lead on to develop jaundice, and in some cases what is called as acute liver failure, wherein the mentation of the patient gets abnormal. They can even lapse into coma. In these patients of acute liver failure, intensive care is needed with medical therapy. Occasionally, few patients also require a liver transplant. Coming to chronic viral hepatitis, hepatitis B, hepatitis C are the most common causes for chronic viral hepatitis. Like hepatitis A, hepatitis E comes via a contaminated water source. Hepatitis B, hepatitis C have a completely different source. Parenteral exposure, sexual contact, exposure to infected needles is the common source for hepatitis B and hepatitis C. Mother to child transmission also constitutes an important risk for hepatitis B to hepatitis C. Once diagnosed with these viruses, your hepatologist is going to find out whether the hepatitis viruses are sitting inactive in the liver or they are becoming active and causing swelling in the liver. If it is causing swelling in the liver, it can lead on to scarring in the liver, which in long term can lead on to cirrhosis. Acute viral hepatitis does not go into cirrhosis, but chronic viral hepatitis by hepatitis B and C can go into cirrhosis. There are very good treatment modalities to manage both hepatitis B and hepatitis C, which is why it is imperative that if you are diagnosed with hepatitis B or C, you have to immediately show to your hepatologist, get their advice, and if you are in a zone wherein you require treatment, you should immediately take treatment to prevent the progression into liver cirrhosis or development of liver cancer. Thank you.